Hi, my name is Cassandra Maldonado and today is the 23rd of September 2013. In my video I'm going to demonstrate 6 airway skills. They include laryngoscopy, BBM, lateral position, triple airway manoeuvre and how to insert an OPA and NPA. I'm also going to be wearing goggles and using gloves. Now I'm going to demonstrate how to perform the lateral side position. The indications for this skill are if the patient is unconscious but breathing, and precautions should be taken if the patient has a suspected spinal injury. To repair the patient, you must maintain natural spinal alignment. We should also check their pockets and the surrounding area for any objects that may harm the patient. We then place a towel or soft object in front of the patient's head, so when we roll them over, they've got some support. We then place their far arm at a 90-degree angle, place their near arm across their chest, and their near leg at a 90-degree angle. We then position ourselves at the hips of the patient, grab onto their shoulder and hip, and rotate them gently. We then place the near leg at a 90-degree angle in front of the patient, and the arm across their chest in front of the patient's head for support. We then ensure the patient's head is extended and we check their airway. A common error that can occur when performing this skill is that we may forget to extend the patient's leg in front of them for support. This may lead to the patient rolling over and including their airway. Now I'm going to demonstrate how to perform the triple airway manoeuvre. First, need to manually clear the patient's airway and suction if required. We then need to position them appropriately. We do this by placing a 2 to 5 centimetre pad beneath the patient's occiput to ensure they're in the supine position. We then need to perform the head tilt and the chin lift. We do this by placing our right hand on the patient's forehead with our thumb facing their nose and placing their chin between our left index finger and thumb. We then apply pressure on the patient's forehead and lift the chin vertically. We've now placed the patient in the sitting position. To perform the triple airway manoeuvre, we'll need to add a jaw thrust. We do this by placing both hands on either side of the patient's head and placing our fifth, fourth and third fingers at the angle of the mandible and our index finger on the body of the mandible and our thumb on the zygomatic of the patient. We then apply pressure at the angle of the mandible and retract the jaw vertically. A common error that can occur when performing this skill is overextending the neck, which can cause kinking of the airway. Now I'm going to demonstrate how to perform a laryngoscopy. The indications for this skill are if the patient doesn't have a present gag reflex and if there's a foreign body occluding the airway. It's also important to note that the laryngoscope should be placed above the patient's vocal cords. To prepare for this skill, I've got the laryngoscope on my left-hand side and the McGill's and the suction on my right-hand side. It's also important to check the light bulb of the laryngoscope to ensure that it's on and that it's secure so it doesn't fall into the patient's airway. To prepare the patient, we manually check their airway and place them in the sleeping position. We then grab the laryngoscope and enter from the patient's right-hand side of their mouth and sweep their tongue over until we reach the molecular groove. We then grab the McGill's and insert this. When we've reached 2 centimetres from the foreign body, we open and remove. A common error that can occur when performing this skill is that we may chip patients' teeth on entry and exit, and they may become a foreign body in the patient's airway. Now I'm going to demonstrate how to insert an OP airway. The indications for this skill are if the patient is unconscious and doesn't have a present gag reflex, or if it can also act as a bite blocker. The contraindications are if the patient has trismus or they are conscious and have a present gag reflex. Before performing this skill, we must first manually check the patient's airway and place them in the triple airway position if required. We then need to measure out the appropriate size OPA. We do this by measuring from the patient's lips to the corner of their jaw. And to double check this, we measure from the patient's lips to the angle of their mandible. We then lubricate the OPA in the patient's saliva or some water and place it in with its natural curve facing upside down. We then continue inserting until we've reached halfway and then rotate the OPA at 180 degrees and continue inserting until the flange is resting on the patient's lips. We also have to ensure that the patient's lips are not pitched between the OPA or their own teeth. A common error that can occur is that the person performing the skill may measure out the OPA incorrectly. As you can see, this OPA is extending past the patient's jaw, therefore is too big for this patient. If this OPA were to be inserted, it may then lead to inadequate ventilation of the patient. Now I'm going to demonstrate how to insert an MPA into the patient. The indications for this skill are the unconscious patient with trismus, and the contraindications are a patient with middle third facial fractures and nasal trauma. Precautions for this skill are the patient with basal skull fracture or CSF leaking from their nose or their ears. To prepare the patient for this skill, we have to manually check their airway and place them in the triple airway manoeuvre if required. We then try to insert an OPA. If this can't be done, we then result to an MPA. To insert an MPA, we have to first measure out that it's the right size for the patient, and we do this by measuring from the corner of their nose to their earlobe. As you can see, this MPA is the correct size for our patient. We then ensure the diameter of the MPA is smaller than the patient's nostril, and we lubricate the MPA with the KY jelly to avoid nasal trauma upon insertion. We then pull the back of the patient's nose towards their eye and place the MPA into their widest nasal cavity. We then rotate clockwise to anti-clockwise until we've inserted the MPA to the measured length. Common error that can occur when performing this skill is that the person performing the skill may choose an MPA that's too large and may insert it the whole way, not to the measured length. When a patient isn't breathing adequately on their own, we need to help them with positive pressure ventilations. To do this, we first need to position the patient in a supine position and insert an OPA into the patient's mouth. We then need to ensure we've got the right size face mask for the patient, in this case an adult face mask. We need to roll it over the patient's face to ensure an adequate seal. We need to ventilate the patient at a rate of 12 breaths per minute. Common error that can occur when ventilating the patient is that we may choose a face mask that's too big for the patient, and this may lead to inadequate seal being formed, therefore inadequate ventilation.